Pleased to have the Health Secretary with us this morning. Hello to you. Busy day for you. Thanks for taking the time to join us this morning. Tell us about your plans to improve access to GPs.
Well, first, I want to thank GPs for the phenomenal work that they've done, especially during the pandemic, but of course, everything they continue to do. And we want to support them to do what they do best, which is to see patients and to see more patients properly and in a way that the patient chooses. And that's what this GP access package is about that we're announcing today. So it includes action on multiple fronts to achieve just that. And, for example, three of the major measures inside this package is an extra £250 million winter access fund that will help increase capacity. There's also measures by the UK Health Security Agency in changes to the social distancing guidance, and then also an expansion of what's called the community pharmacy scheme. And taken together with all the other measures, this will help GPs to see more people face-to-face and more properly.
Should everyone who wants a face-to-face appointment be able to have one?
Yeah, I think patients, I believe in choice. Yeah, so I think that's what patients want to see, and the vast majority of GPs I talk to, they say, look, if you can help us to increase capacity, if you can provide us support, that's also what we want to do. So I think patients should have a choice, and if there are some that will absolutely choose that they prefer remote or online versus face-to-face, and that absolutely can be right for them, but there should be a choice.
They feel as though they're under pressure, though, don't they? They feel like they're being battered by the government at the moment and they're doing everything that they possibly can.
I think GPs are working incredibly hard, and especially over the last couple of years. I mean, could there have been a more testing time for anyone working in healthcare? It's hard to have imagined that, and I think they have what they've done, especially around the vaccination programme, for example, has been phenomenal. But at the same time, we've also seen an increase in the waiting lists for the NHS more generally. We've seen people stay away from the NHS, including their GPs, for understandable reasons during the pandemic, and so we do need to increase capacity. And there are many people that they want to be seen in a certain way, and I think it's right that we support GPs deliver that.
Yeah, but GPs are seeing people more face-to-face now than they ever have been, aren't they?
And I think from what I've seen, the latest numbers that are published by the NHS, before the pandemic, I think it was roughly around 80% of consultations were face-to-face. At the moment, it's around 60%. And GPs...
I'm just looking at some figures, so I don't know if you recognise these. In the week beginning 16th of August, GPs provided 5.6 million appointments and gave 374,000 COVID jabs, 2019, for the equivalent week, 5.3 million appointments and no jabs. And there are 1,900 fewer GPs over that time. So they're doing more work now than they've ever done before.
Well, maybe the stats you're reading there is total appointments rather than broken down between sort of remote and face-to-face. But it's true, certainly GPs are seeing more people, including vaccinations. They've been an important part of our vaccination programme, especially for elderly people and going into care homes in many cases. And that's been really vital support. In terms of GP numbers, which you just touched on, look, we do have a shortage of GPs in this country, and the government has recognised that. Over the last 2 years, we've actually seen an increase in the full-time equivalent number of GPs of something like, I think, 1,200. So we have seen an increase, but I want to see a lot more GPs.
1,900
so this year,
fewer GPs over that period of time.
Over the last 2 years, there's been an increase. Depending on how far back you go, you can have different numbers.
Well, in 2015, Cameron was promising us every week at the dispatch box there'd be 5,000 more GPs. Where are they?
Well, I want to see more GPs, and it will take time to get more GPs into the system. This year, I was
6
pleased.
years ago,
well, this summer we had the highest number of students enter medical school for GP training, and that does mean we're building that pipeline. But look, we've been very clear about this. I think that we do need more clinicians generally throughout the NHS, whether that's in primary care, in acute care, and that is something that's happening. Nurses, we're hiring many more nurses as well, and that support continues, and that continues with record funding into the NHS.
Okay.
Both over the pandemic and before that with the long-term plan. But today's announcement is about GP access, and it's right that we provide more support.
Shouldn't we be enjoying them embracing the tech, though? I mean, they're embracing the technology. You don't have to be face-to-face. Quite often I interview your colleagues down the line. Doesn't mean that what they're saying is any less effective.
We should absolutely be making maximum use of technology throughout the NHS. It's something I've talked about very recently, actually, how I want to see that. And what we have seen during the pandemic is that people understand at that time, at the height of the pandemic, you could only be seen remotely. Everyone understands that. And there will be some people that think maybe if they've done that for the first time, that suits them. They might have a busy life, it might be a minor illness, and that might suit them, and that's a decision for them. But what I've also heard is from GPs directly is that we need more support. You need to cut away some of the bureaucracy we face. You need to give us more funding so that we can perhaps work overtime and open longer hours and support us with that. And you need to speak to the UKHSA to see if they will continue with their review of the NHS and the infection control guidance, and which is what's happened. And so we've been listening. We've taken action, and I want to thank again GPs for everything that they're doing. They will continue to have the full support of the government, of the NHS in everything that they do.
Yeah, are you listening though? I mean, a survey from the BMA, giving you figures again, 50% of doctors suffering from anxiety, depression, stress or burnout, 60% high levels of fatigue, 30% taking up additional unpaid hours to try to make sure they're there for their patients when they're needed. I was speaking to a GP this morning who said to me, ask him, who runs the NHS, you or the Daily Mail?
Well, the NHS is run, everyone knows how the NHS is run through a professional, serious management. We've just appointed a new CEO of the NHS, and it's GPs that will decide in their particular surgery how they're going to run that day to day. But what they've also, what they've also said is that they need more support to see more patients.
They're burnt out, they're knackered, they're depressed, and they feel that you're bashing them.
Well, actually, there have actually been, over the last few months, I've certainly noticed while I've been in this job, there have been some horrid cases of abuse towards health workers, to social care workers, to GPs included in that. And I have to say that is totally unacceptable at any level. There's a zero tolerance, as far as I'm concerned, about abuse to anyone in health and social care. And one of the reasons actually GPs have said to me that they feel pressured is because of some of the abuse that they suffer. It might be online abuse, it might be anonymous. And one of the things I've included in this package as well is, for the first time, a £5 million security fund. So for those GP surgeries that feel that they want to take extra measures on security, there's support for that as well. And a final thing, if I may mention, something else I do want to do, and I can't announce the full details of it today because I want to work with GPs and the NHS more broadly and get it right, is when I was a Home Secretary, I decided I wanted to do something that became the police covenant, to provide more long-term support, put it into law for police in that case, of course. And I want to do something very similar for all NHS workers, of course, including our fantastic GPs. And I want to work with people and get that right to show and also demonstrate and give more support.
Yeah, they don't feel supported. They feel bashed by the government. That's my point. They don't feel that you've got their back.
Well, this whole package today is about support. The funding that we're putting in, the extra 250 million, £250 million of new, fresh funding is something that we've been asked for. And in fact, many people, from the feedback I've got already, have been surprised by the size of the financial support that's being provided, but the support we're providing through working with the pharmacists so that they can take some of that load off GPs and deal with some of the minor illnesses, the support we're providing in taking away some of the red tape. I mean, this is all support, and it's all about helping GPs so they can do what they love best, which is seeing their patients.
But, you plan to name and shame those who don't actually reach those targets that you're going to put in front of them.
For that. I mean, what we are doing is
perception is reality, and this is what a GP said to me this morning when I told him that you were coming into the programme. These are the points that he wanted me to put.
And that GP, obviously, I don't know who that is, but they're entitled, of course, to their views. But it's also important that we stick to facts. And so what we are doing is providing more data and more transparency.
So these are people on the front line and they don't understand the facts, is that what you're saying?
Well, we've published a document today. I don't know if the document was published this morning at around 6 a.m. So I don't know whether the person that you're referring to has had the time to read the entire document, which goes into a number of pages and goes into immense detail. I mean, do you know if the person read the document first?
I have no idea.
Well, there you go. So, based on the facts,
do you think this is based on what I'm telling you is based on the facts? That is going to change all of the frustrations of these GPs, half of whom are suffering from depression?
I think it's going to help because this is about providing more support, more financial support, removing the red tape that GPs have often talked to me about. It's about spreading the workload for primary care, for example, using the community pharmacy scheme more. It's to provide support also. There's a plan in there to provide direct support to those practices that ask for it, that would like more expert advice, and the NHS can send in a team and help them with that. And the point I just wanted to make, because you did touch on it, it's about transparency. At the moment, when you get data at a GP level, it's only available at a regional level, not practice by practice. The NHS now, for well over a year, has been piloting a scheme, I think, with 60 practices, where it's practice by practice data. And this is important. It's important that patients have this information, because I also want to see a levelling up of healthcare throughout the country. I've talked a lot about disparities in healthcare, and I think we do need to understand what the differences in healthcare provision are across the country and have the best data available.
OK, you talked about transparency there. Did we ever intend to stick to the protocol when it came to the Brexit agreement over Northern Ireland? Because, of course, you'll know Mr Cummings has said we signed the deal never planning to stick to it and to ditch the bits we didn't like further down the line.
But we signed that agreement in good faith. I was in the government then in a different role, and I know we signed it in good faith. And, of course, it's been 2 years, roughly, since then, and it's right that we look at how it's working. We don't think it's working well in practice. We think, for example, the EU is taking an over-legalistic approach, and I think it's right that we talk to our friends in the EU again and see if any changes can be made.
So what they've said is, as you know, because I'm sure you've read it, they're basically budging on 80% of the options for, amongst other things, sausage wars, as it's been described. But one thing, they've even moved a little bit as far as what the European Court of Justice is concerned, and whether they will be overseeing the change in rules. Is that going to be enough?
I haven't seen the EU document yet. I haven't had any time to study it. It's good that they're engaging with this discussion. I know, for example, from the area that I'm responsible for, medicines, healthcare more broadly, that we've had issues with medicine supply in Northern Ireland, and no one wants to see issues like that. It's not in anyone's interest, whether they're in Northern Ireland or Ireland, for that matter. And I think it's important that these discussions continue, and if sensible changes can be made, that's exactly what we'd want to see.
Is the European Court of Justice a red line for the government?
I think we do. There's no really... Looking forward, there should not be a role for the European Court of Justice in anywhere, any part of the UK, and that includes Northern Ireland. I think it's an over-legalistic approach that the court has.
So they've got the sticky fingers anywhere near it. It's not a deal.
And I think Lord Frost has been really clear about this with the speech that he made this week, and what he said, I think, are the principal arguments. And one of those issues, one of the most important issues, is to end the role of the ECJ in Northern Ireland. And I think that's one of the better ways to make sure that we're also protecting what was agreed in the Good Friday Agreement for the benefit of not just everyone in Northern Ireland, but in Ireland too, the whole island of Ireland.
Yeah, safety and security in Northern Ireland, of course. But it does sound as though we're going to reject it, from what you're saying.
Look, that's not a decision for me, and I'm focused on health matters. You've asked me about the protocol. I've shared my views,
but you're representing the government this morning, of course,
I know it's something that Lord Frost will look at very carefully, and if the government decides to take a different approach, then it will be a collective decision.
OK, just a quick thought before I let you go. I read in the paper this morning that your mum had always wanted you to be a doctor. I'm guessing she might want you to be a lorry driver at the moment. We're in short supply.
Well, I think the government's addressing that issue. There's a short supply of lorry drivers across the world, and I think there's a shortage of 400,000, roughly, in Europe, and some 70,000
I wonder why they don't want to come here. We wanted 5,020 so far.
I think being a lorry driver is a great job, by the way, and so I hope that...
You managed to get that in just under the wire through our lorry drivers this morning.
And I hope that more people are attracted to that.
Why do you think they're not?
I think it's multiple issues. It's got to... We're seeing this issue across Europe, actually recently in the US as well. There's a shortage, and it's I think a lot of it has to do with the pandemic and the sudden demand that's been created as the world's in effect sort of waking up after the economic shock. And it will take some time to sort this out. In terms of what we've done in the UK to attract more people into the industry, that's going to help. And I'm sure that this will be something that will be resolved in the months to come.